you don't really see a dramatic improvement in migraine, then it is actually, it's a good point to really sit back and look at how effective you feel the treatment is. There are a number of ways people can learn to predict their migraine attacks early. Sometimes you can have very well-defined, recognized triggers. Like for women, the menstrual cycle can be a big trigger. So for a number of female patients, you may realize that the day or two before your period is when you're going to have the migraines. And there are menstrual migraine-specific treatments for that reason. You may recognize certain environmental triggers, like weather changes are often a very frequent trigger. For some patients, alcohol can be a big trigger, lack of caffeine, travel, sleep deprivation. Minimizing these triggers can be important, but sometimes knowing that you're going to be in a situation that's going to provoke a headache can give you a heads up that maybe it's time to do something or take something to turn that headache off as soon as it starts. It's important to not ignore early warning signs of a migraine because it may progress into a more severe, intractable migraine. There are sometimes conditions where people will go into migraines that don't really respond to the treatments they take to treat the acute migraines, and that's why it's important to treat early. Sometimes you can get really stuck in these headache cycles and they can go on for a while, in which case you may need something stronger to break them. Overall, headache hygiene is very important in preventing migraines for people who are susceptible to them. Routine sleep is very important. Eating regularly throughout the day is very important. Hypoglycemia or low blood sugar can be a significant trigger for a lot of people. Dehydration is a big trigger for a lot of people, so it's important to make sure you're hydrating. Exercise can be very important in controlling migraines as well, and limiting screen time. Screens can be a provoking factor for some people as well. Acute migraine medications, when taken too frequently, can cause something called medication overuse headache. All acute treatments have some degree of risk for causing medication overuse. Certain medications carry higher risk than others. In particular, opioids and barbiturates seem to be very high risk for medication overuse. And the issue with medication overuse is it can actually make your overall migraines worse. You can go from having a few migraines a month to having 15 plus migraines a month just by overusing your acute treatment. The general rule of thumb is you should not be taking an acute treatment more than 2 to 3 times a week. If your treatment's really not working, you should come in and see your doctor and try to give them a good picture of why it's not working. Are you taking it routinely every day? Is it causing side effects? Are you just still having a lot of migraines despite taking the medication? There may be different ways to intervene depending on what's going on.